According to Acting Chief Medical Officer Dr. Sean Charles' explanation, it appears that the purpose of the COVID-19 vaccines is unclear. Here's what they're expecting the vaccine will do.
Present our best expectation is that the vaccine prevents disease, prevents someone from getting sick, and in particular prevents persons from having severe illness and as such reducing deaths. So until we have evidence that the vaccines prevent infection and a person who is vaccinated cannot transmit the disease if they're infected, our protocols would remain the same.
One must be mindful that there is no vaccination policy yet in place, though some countries have started the process of using a certain type of vaccine. Though not much is clear on its potential to cure or more so to prevent the virus, Grenada's Minister for Health, Nicholas Steele, explains Grenada's position pending an official declaration on how soon it will be rolled out here and on whom. The health minister identified one of the vaccines that have met approval by the World Health Organization.
One of those vaccines has already been certified by WHO. That one, which is the Pfizer-BioNTech, has challenges logistically, not just for us, but for even the very same first world nations that are implementing it. You will see in today's headlines that there are questions in terms of the rate of implementation. It is because it needs what is referred to as extreme cold chain. It has to be kept at minus 72 degrees throughout its process, getting it here as well as storing it here before distribution. So it poses challenges. We haven't ruled that out. We have addressed and looked at what we would need to do to deal with the Pfizer-BioNTech if that is the one that we end up going with. Other vaccines, like the AstraZeneca, that do not require that level of cold chain, that level of minus 72, that have a level of storage temperature-wise that we are accustomed dealing with, that we deal with right now with other vaccines and medications. So it is our desire to go that route. We do need to accelerate the process, and we are accelerating the process. By the end of this week, I will be able to give you further updates on the progress we have made with our vaccine, not just in getting it, but in accelerating its process of delivery to our nationals here.
According to the Acting Chief Medical Officer, there is no specific evidence to prove that the vaccine prevents infection and that a person vaccinated cannot transmit the disease to someone that is not immune. Therefore, persons vaccinated coming into the country will have to go through the same process of quarantine. In the public's domain, there remains a number of unanswered questions. Christina John, GBN News.